Buongiorno. Good morning. I was in the Principality of Wales about 2 months ago, addressing briefly a conference on the older adult with autism. It's much easier to say buongiorno. There, it took me a whole week to learn to say good morning in Welsh. And thank you for inviting me to your conference. I've forgotten it now, so thank you very much for inviting me to your conference. My name is Michael Barron. As you can see, well, maybe you can't see, I'm about 82 years old, and my son is aged 54, and he was diagnosed firstly with juvenile schizophrenia in 1960, I think. Then it was changed to childhood psychosis, and eventually it became autism. Now, you can't see this very well, but this is the cover of the magazine National Autistic Society Communication 2 years ago. And there he is on the cover. The title says, Growing Older, Aging with Autism. And I look at this regularly because he says to me, Dad, I'm getting older. What are you going to do about it? And that's why I say, I add, when very recently he was asked how old he was, he said he was 21. I think he's always been 21, and maybe for the next, we don't know how many years, that's the issue, he'll still be 21. Now, when I go through this, you'll see some magic words appear in it, or magic abbreviations, and one of them is ASC. And I've been here for 2 days, I haven't heard ASC mentioned yet. It's always ASD. So you have to know that in England, which in many ways is a very strange country, it's now called autistic spectrum conditions. It's not a disorder, it's a set of conditions. And it's all here contained in this rather important document called the Autism Act 2009. Well, one could argue whether this is a good thing or a bad thing. So where you see ASC up on the screen, please also read ASD, Autism Spectrum Disorders. I feel a little awkward here. I'm a sort of parent sandwiched between Pat, who's a professional, and there's another professional following me. And I'm sort of, in more ways than one, the odd man out here. And what I'm going to talk about is really more or less based on work that's done at the Institute for Aging and Health at the University of Newcastle, where we held the first one-day conference on aging and autism about this time last year. So this is a fairly sort of technical document, and I'm a parent, not a scientist, so you have to bear with me, and have to bear with me as I go through it. Most of the work has been done by Newcastle, who can't be here. So, what about old age in autism? Well, there we have a picture. And this follows the substantial change in demographics in this century. By 2026, we reckon, in the United Kingdom, 1.7 million elderly adults will need some type of 24-hour care. And at least 1% of those adults will be on the autistic spectrum. And we don't know how many of them will be undiagnosed autistic spectrum people, and we don't know how many will be high-functioning Asperger's. So the current situation, as you can see, there's a big question mark about the services, social, clinical care and education and training that we need. Chronic illness and longevity. Again, I beg your pardon. On the left, oh, it's going too quickly for me. On the left, we said that in the 19th century, in infectious diseases and acute illnesses, were gradually controlled and people's life expectancy increased. That is continuing in this century, with chronic diseases and degenerative illnesses also being tackled, but there is comorbidity with other illnesses. So again, life expectancy has increased. So the current state is that there is no data regarding aging ASC populations in the United Kingdom or the world. In 2009, in Wales, which is a very advanced country as far as autism is concerned, they set out to survey the existence of high-functioning ASC people in their 40s, and they interviewed a sample of high-functioning people, which means they could answer questionnaires. And that indicated there were 5 times higher rates of anxiety and depression than the national average, a lower quality of life, lower than average income, and a poor record of relationship and friendship. That Welsh survey only dealt with that group, and they want to continue their survey into other groups, which involves far more work. And actually down here, I have a leaflet that's been written by Professor Hamilton of the University of De Morgan, asking for cooperation in research, and you're free to take one away with you. So, how about old age? Right. I beg your pardon. We're coming to something about IQs, aren't we? Here it is. No, way back. No, further back. Further back still. Further back. Here we are. Okay, right. Apologies. Here is a little table about 20 years outcomes for ASC adults. Again, how about old age? On the left, you'll see the results of IQ tests. One section headed non-verbal, the other verbal, and then the results. Childhood and opposed to adult. Now, I think Pat Howlett has talked about this paper in a different way, but it just shows you that on these IQ scores, surprisingly, there's a substantial improvement in 33% of the people who were in this survey, but there was a loss of 23%. So another of our problems is how to identify those on the spectrum that will improve and what's going to happen to them when they age. Well, what's the current state of affairs? Well, very limited research. In fact, the theme of what I'm going to say is all about the need for research. Very limited research. Elderly ASC people are referred often due to affective disorders, which we mean anxiety and depression, cognitive or physical problems, and that's all set out in a paper in the paper of 2006. And some of us are worried that if 1 in 3 elderly persons will develop dementia, some in that cohort will also have an autistic spectrum condition, but there is no data. There are case reports about Alzheimer's disease, vascular and frontal temporal lobe dementia in autistic spectrum conditions, but there are no large-scale studies conducted to date. What about the clinical reality? Elderly people with ASC not diagnosed are admitted on medical wards. This is the experience in Newcastle-on-Tyne, on which most of this is based. Newcastle-on-Tyne Liaison Old Age Persons Team have found elderly ASC people with behavioural problems, bizarre behaviour, anxiety, aggression, memory problems, suicidal ideas and serious suicidal attempts. And there is a real problem about carrying out mental capacity assessments under the Mental Capacity Act in order to carry out treatment and to get your assessment right and to make sure that the patient understands what the doctor wants to do. So, here is an example. Ray. He's a 65-year-old man with terminal cancer and sepsis. He requires antibiotic treatment. And the doctor says, you know that you are seriously ill and that we need to do some additional tests. The tests so far have shown a serious and widespread infection that needs to be treated. You can imagine a doctor saying this in all seriousness. I would like you to have intravenous medications. Is this okay with you? We will start today. And then the patient says, no, absolutely not. And he is very agitated, he is very angry, and he's aggressive because he doesn't really understand the question. And therefore, he is diagnosed early in the morning with paranoid schizophrenia.